Welcome to On Call Medical Radio, a production of the Healing Words Foundation. Here with today's guest is On Call Medical Editor, Dr. Rick Holm.
We're here talking with Dr. Paul Carpenter, a cardiology internist from Sioux Falls at North Central Heart and the Avera Heart Hospital. And we're talking about heart failure. Paul, what is heart failure?
That's where the heart as a pump isn't doing an adequate job. It's getting behind, and so the fluid backs up into the lungs. A person cannot breathe because there's too much fluid interact in between the lungs, exchange of oxygen and carbon dioxide.
Mm-hmm. So when the heart squeezes, generally it squeezes, what, like 50, 60% empties,
Yes.
right? When a person is in heart failure?
There are several kinds of heart failure, but there's a dilated cardiomyopathy, and that's where you have an ejection fraction that may be 30-35%, sometimes as low as 10 to 15%. But there's another kind of heart failure where it's called diastolic heart failure, and that's where you have more of a thick muscle that contracts well, but it's stiff. And you need to have the blood fill into the left ventricle, and if it's so stiff, it doesn't dilate at all to accommodate much blood. And that's diastolic heart failure, which is actually a little harder to treat than the dilated cardiomyopathy.
And very quickly, what causes heart failure? A lot of causes.
A lot of causes. Heart attacks. You can have other illnesses where the heart dilates, like a viral cardiomyopathy. And especially the kind that is the diastolic heart failure, the thick heart muscle is often people that have had high blood pressure that has gone untreated for years.
So a lot of causes.
A lot of causes.
All right, and we'll talk about treatment in just a minute.
Watch On Call. Physicians from around the state using science-based, reliable medical information to answer your questions live. Thursday nights at 7 Central, 6 Mountain on South Dakota Public Broadcasting.
We're back talking with Dr. Paul Carpenter, cardiology internist from Sioux Falls. So what do we do for these kinds of heart failure?
One of the things we use are diuretics, water pills. There's a backup of fluid, and so you need to get rid of that fluid. Often there's some swelling of the ankles, as well as that's in the lungs. Mm-hmm. So you use some diuretics. We will use drugs called beta blockers that slow the heart rate down, and the heart actually improves with slowing the rate down, and you actually may improve the ejection fraction. You have drugs called ACE inhibitors or ARB drugs. These are blood pressure medications that are vasodilators, and it allows the heart to pump against less resistance. If you have a blood pressure that's 110 versus 140, the heart doesn't have to work as hard.
Right. Take-home message?
If you're short of breath, your ankles are swelling, you need to get in to see your physician and see if there's something that make you feel a lot better.
Great. Well, thank you so much for joining us, Paul.
You're welcome.
And until next time, stay healthy out there, people.
You've been listening to On Call Medical Radio. On Call is produced by the Healing Words Foundation and made possible in part by the South Dakota Foundation for Medical Care. The foundation strongly urges all of us to remember immunizations this season. Pneumonia and flu shots save lives.